is Dr. Jennifer Mensik Kennedy, and I am president of the American Nurses Association.
What experience or moment shaped your leadership, and how does it influence how you lead today?
I think there's a lot of moments throughout my life that have led to this moment. I think one of those important pieces was, I decided when I was getting my RN to BSN that I wanted to be a nurse practitioner, but in my RN to BSN program, I realized that wasn't going to be what I wanted to do. And I wanted to get an MBA instead because I was more systems and leadership focused. And in my MBA program, I was one of only a few nurses. And we had a lot of people who were not clinicians who thought they were going to change healthcare and improve healthcare. And that was an aha moment for me, because here we are as nurses. Who better to change healthcare than the people who walk alongside of patients 24/7, who know where the struggles are? We know where the system failures are because we have been with patients. And that made me really realize how powerful nursing is and how we really needed to be at the table, because I think we have all the answers almost to fixing the systems that we're in.
As the largest segment of the healthcare workforce, I'm sure when we put all our heads together, we've got the answers here. So that kind of segues into some organizational priorities. Obviously, right now, there's a lot of complex challenges and changes. Almost every moment you look up, there's a policy change, there's a new proposal for something. Health Resources and Services Administration, HRSA, continues to project an ongoing imbalance in the nursing workforce over the next decade. In the backdrop of all of these changes, there are certain areas, perhaps some of our rural areas, who may have lack of access. And then also within certain specialties, there just aren't enough providers. So what is it that we as nurses should expect or do so we can help meet our nation's needs?
There is a lot of issues going on, right? So we have faculty shortages where we have over 80,000 qualified applicants who are turned away from nursing school because we just don't have the space for them. We have the Department of Education who is trying to limit the loan amounts for individuals. And let me say, I graduated with all of my school over 20 years ago. I had $100,000 in school loans 20 years ago, and education has continued to get more expensive. I think looking also from the workplace and the work environment, rural health is going to have double the shortage than our urban and metropolitan areas. And that's where we look at utilizing technology, utilizing nurses, advanced practice nurses to provide the care that those communities need, because it's absolutely important. But I would want all of us as nurses to be able to share our stories with your representatives, whether it's a state level or whether it's a federal level senator or representative, because it's your story that's going to provide life into changes that will be positive for our patients and our healthcare system.
And it's important that we talk to our legislators, but what are your thoughts about nurses becoming the legislators? Because when we think of actionable items, we're knocking on doors, we're talking till we run out of breath. What do you foresee with nurses entering politics? Many nurses would say, well, we were told not to get involved in politics. We just care for the patients. So what do you say to that old philosophy?
There's nothing that you do in your life, whether it's at your work or your license or the school that your kids go to or anything, your community, that isn't driven by a policy or legislation that someone else created. You live your entire life in these policies. And so if you don't help to create them, you are allowing yourself to live in someone else's policies and legislation. We know nurses need to be at the table. Why not be legislators? Why the lawyers or the plumbers, the electricians, the business owners who have no understanding of healthcare making decisions from a healthcare perspective? There was a Nursing Outlook article a couple of years ago that was published that talks about the decline of the number of nurses in legislative positions across our country. We need to go back and to change this. And I can tell you, my nurse legislators have been some of the biggest advocates. In Oregon, I have Representative Travis Nelson, and he's a registered nurse. And I've been able to go to him and say, hey, I think we really need policy. So we were able to pass first in the country legislation last year, protecting the title of registered nurse, LPN, APRN from AI. So we had title protection against AI here in Oregon because I went there and worked with my nurse legislator who understood this. And he was able to sponsor and put forward legislation that passed in Oregon that also allows registered nurses to bill Medicaid without a provider. And so, if you really want to change the system, those nurse legislators understand what we need to do, and working together, it's a real strong combination to really make improvements in healthcare.
Well, we need them at the bedside, obviously, because we're always going to have patients to take care of, but that should empower us to